How to kinesio tape for foot pain and inflammation. A Burkhardt Physical Therapy Center, LLC production.
My name is Sean. I'm a doctor of physical therapy at Burkhardt Physical Therapy Center in West Salem, Wisconsin. Today we're going to be going over a couple of kinesio taping techniques for the foot. These techniques can be used for any type of plantar fascia pain, foot pain, toe pain, any swelling in the foot, and other things, issues that you come up with when you're running, walking, doing stairs. So this first technique, I have 2 strips already pre-cut. And what I'm going to do is be anchoring the strip at the heel and running it up on the inside of the foot along the muscle belly with the big toe up until right before you start at the big toe. And to make sure I know I'm at the spot where I want to be, I'm going to pull the toe back and I can feel that top band underneath my fingers. Okay, so I rip the edge of the strip here, placing that anchor right at the bottom of the heel. And then as I come up, applying a little bit of stretch, about 25 to 50% stretch with the tape as I run with the foot pulled up as far as you can. As I run the tape up, I'm making sure I'm following that muscle belly up along the inside of the foot. And then at the end, I want to make sure there's no stretch again as I anchor the other side of the tape. And then you're just rubbing the tape to get that adhesive started so that the tape doesn't come off. For the second strip, I'm going to rip the end again, placing the anchor can be right over top of the other one, and placing that same amount of stretch on the tape as I'm coming up. Again, you want to make sure that that foot is pulled up as far as you can, and guiding that tape up along the bottom of the foot. And you can see it runs up on both the inside and the outside of the foot, providing good support. And then for a little extra support, or if there's an area of increased pain, you can take a shorter strip and place that laterally. You're going to rip in the middle and stretch it all the way and place it right over top wherever that most sore spot is, whether it's right above the heel or along the arch if you need more support through the arch, or even if it's more towards the top of the foot. You're ripping and placing that laterally right across the foot. For the second technique, I already have the strips pre-cut, and these are you can see 5 different strips here, and that's for each digit of the foot. So we have the anchor on the bottom, and then a strip for each one. So again, for this one, I'm going to anchor it right on the heel. And if you want to, you can come up back behind the heel a little bit more. Sometimes it gets stuck on your socks a little bit when they rub up and down, or the back of your shoe. So I like to keep it right on the bottom of the heel. I'm going to put that anchor strip on without any stretch. And then again, for each of the single strips, I'm just going to put on that 25 to 50% stretch, keeping that foot pulled up, running right along each digit. So this technique's just a little bit more complicated because you have several more strips and you really have to follow each digit up. But it can help if there's a little bit more swelling in the foot. This type of technique really helps a lot to remove some of that fluid away from the foot and back up into the body. And at the end of this technique, you can again take that lateral strip and place it over any area of increased pain anywhere along the foot. You just want to make sure that your tape is stuck pretty well to the bottom of the foot. It can come off pretty easily just because when you're putting socks on and off, it's really easy to get them caught up in there. So making sure each strip is stuck pretty well to the bottom of the foot. And you can take that compression strip again, applying that full stretch of the tape anywhere along the foot. So this is the 2 techniques for any type of plantar fascia pain, foot pain, toe pain. When you're done, just walk around on the tape a little bit, make sure it's comfortable. It shouldn't feel uncomfortable when you're walking. You might have to readjust or retape to get that right fit. For more kinesio tape videos, visit our website at www.burkhardtpt.com or visit our Facebook page at Burkhardt Physical Therapy Center.